The first story is raised by you, Padraig. It's the health crisis, which just seems to be getting worse and worse. Do you want to lead with this one?
Okay, I'll give you some background on this, Finbar. So, campaigners from the Midwest have met other hospital campaigners from around the country to plan a national day of marches as the overcrowding crisis continues. Limerick City was already earmarked for a march by local campaigner Mike Daly, set for January the 24th to draw attention to long waiting times at the emergency department at University Hospital Limerick. This could now be joined by protests north and south of the border. Mr. Daly said he welcomed the growing interest in protests. He said, "We have buses coming in from all over for this." UHL is the only emergency department covering Limerick, North Tipperary, and Clare, and has faced unusually high patient numbers for months. There are people coming from North Cork and as far as Lahinch and Clare to be seen in UHL, which is incredible, he said. A bus is being funded to bring Clare protesters to the Limerick March by the Women's Collective Ireland, Clare PPN and Clare Travellers Community Development Project. Separately, TD Padraig, who heads the Save the Navan Hospital campaign, also held a meeting attended by people in Drogheda, Monaghan, Cavan, Letterkenny, as well as Daisy Hill, Newry, Causeway Coast and Coleraine in the north. Hospital campaigns in Enniskillen, Sligo, Cork, Kerry, Bantry and Wexford are also considering getting involved, he said. "We believe that we may have reached breaking point. The HSE has spent the last 15 years closing 8 A&Es and thousands of hospital beds. Primary care and step-down facilities have been allowed to corrode to the point of dysfunction." He urged, "We are urging citizens to come out in numbers on the 21st of January. Finbar, you'll just see on the second side of that image there, there's a story about delays in terms of its impact. So delays in patients getting a hospital bed will potentially cause at least 50 unnecessary deaths in a week based on current figures. An analysis carried out by a leading data scientist and A&E expert reveals. Stephen Black, a data scientist from Belfast with extensive experience analysing NHS and HSE emergency rooms, said weekly data provided by the health authorities here suggests that 51 preventable deaths a week will occur due to current record overcrowding levels and lengthening A&E waiting times. Mr. Black based his estimates on the findings of a major study he carried out examining links between long A&E waiting lists and mortality rates, which was published in the Emergency Medicine Journal last year. He said the figures of 50 deaths a week, which he described as very conservative estimate, mirrors trends in the UK. This is outrageous stuff, and I know there's an awful lot of media coverage, but it doesn't seem to be really hitting the Richter scale. Like these two stories that we're bringing here. So like there's a major upheaval in society. There's a lot of people interested in protesting, which is great to hear. And on the other side of it, then the quite unbelievable study that's saying up to 50 unnecessary deaths a week.
Hmm. You know, this has just been going on for years. I've seen figures about how we've reduced the number of hospital beds we have by thousands upon thousands upon thousands. Since 1980, we've just decimated our number since the 1980s, our hospital bed numbers. And yet we've been told we have a whole new health system that doesn't require those beds. That's what we're told. We have this care in the community system that we're being told about. And yet, look at these images coming out of hospitals. Look at every day I read stories of elderly people for days in accident and emergency areas where they probably die from being stuck there and going into a panic and a depression. So it's just shocking. But as I say, this is like a tradition in Ireland at this stage. 12 years ago, the then Fine Gael Taoiseach, or Irish Prime Minister, if you're not from Ireland and you're watching this, Enda Kenny, spoke about his party's failure to meet their promises to fix this problem 12 years ago. And remember that Enda Kenny party is now in government again. Their new leader, Leo Varadkar, or newish enough leader, Leo Varadkar, is now the Taoiseach, or the Irish Prime Minister, and he was the Minister for Health at one time. There's been no change. Things have just got worse. Our population is growing, and we have no capacity to meet it in our health system. This is Enda Kenny 12 years ago.
Pledged in 2011 that you would end the trolley crisis and that you would end waiting lists. I regret that we haven't been able to do that.
So he regrets that 12 years ago that they haven't. So Fine Gael and government haven't been able to do that. Here we are 12 years later, we're worse than ever. Any final comments on this before we move on, Patrick?
It's a deliberate policy. It's in line with neoliberal privatization. It's not an accident. This is by design, and everything they do is just paper over the cracks each year. The 50 billion spent on COVID, scandal that we haven't done something in our hospitals.
I don't know if it is even, my doctorate degree looked at the organizational culture of public health in Ireland, and that traditional to and fro argument in terms of private public has always overly preoccupied the developmental aspects of our health service, and focusing on that and arguing about that rather than focusing on quality of care. That's been my opinion from my readings on it. This is something else, because whether you're private or public, if you need to phone an ambulance in Ireland, you don't phone a private ambulance. If it's an emergency, you phone 999 and you get an ambulance out to you, and it takes you to an A&E. And when you go into that A&E, whether you like it or not, it's packed. And there's private and public patients packed, and you're going to be waiting all that time. So this is beyond private and public. This is about the need for the basics in terms of emergency care. And where I come from in County Louth, they closed the accident and emergency facilities in terms of medical requirements. So it was just if you break an arm or something, you can still go to the A&E in Dundalk. But if you have a heart attack, if you get hit in the head, anything like that, you now have to go to Drogheda. And the time to get there is maybe half an hour after you waited for your ambulance, after they've all done all the stuff in the house with you, half an hour, where it was just around the corner. My father was the final patient in the male medical of the Louth County Hospital, and he wasn't long out of it, and it was closed, and he had a stroke, and I had to get into the ambulance with him to go to an A&E, and we had to go past our own hospital and drive all the way to Drogheda with my father in that state, and it was the most frustrating experience I ever had in my life. And the feeling that I had as we actually went past that A&E, that could have been in there, to save my father. So, yeah, listen, it's ongoing. This is about competency. This is about having a government that actually wants to focus on services rather than focus on their own image and flying around the world promoting themselves. This should be about competency.